flow issues and the crowding issues within hospital are a national problem, and ULHT has adopted several of the national strategies to deal with this. In terms of things that people on the wards can do, it's really important that every aspect of a patient's journey is as efficient and as timely as possible. So to that end, the Trust have taken on the Red to Green Day initiative to make sure that every patient in every bed in the hospital has a positive outcome from each day spent in hospital that should progress them a step further in their care. So making sure that that's happening, making sure that if patients are identified for discharge, that that's done prospectively. So when patients do become fit for discharge, they can be discharged from hospital in a timely manner. The other aspect is we're introducing streaming at triage, which will again provide a quicker assessment of patients, getting them flowed into the right area. And we're expanding our nurse practitioner workforce to provide a greater minor illness service through our minors area. The rapid assessment area at the minute we're just using for patients who present by ambulance, and the idea is that rather than patients waiting to be seen by a doctor for a full assessment, when they first come in they're seen by a rapid assessment team, which includes a senior doctor and members of the nursing team, who provide an initial assessment, provide timely treatment for essential things. So for example, looking at the sepsis bundle, we in that area would identify sepsis, start the sepsis 6 in a timely manner. We also order different investigations depending on the patient's needs. So actually by the time they move through into the majors area for a full assessment, those tests have already been done, so they're waiting just the once rather than twice. The rapid assessment process is part of that. We have 3 beds within the rapid assessment area, and we will take handovers for patients into that area. And that means that those patients are getting their investigations done earlier, which means less time for those patients in ED, which creates better flow for patients who are ultimately going to be discharged, or quicker referral onto appropriate specialty. We also provide the rapid assessment service once those cubicles are full for patients who are actually waiting in the ambulance queue. The idea of the rapid assessment and the other changes we've made in A&E is to never have an ambulance queue. However, in terms of where we're at the minute, we do still have problems with outflow from the department and crowding in A&E, and therefore even if patients aren't able to physically get a cubicle space in the majors area, we're still providing them with timely assessment and treatment whilst they're waiting for that space. We're also making sure that those patients are being seen in the right area of the emergency department and being streamed appropriately by a senior clinician. So for example, earlier today I saw a gentleman who came in with a leg splint on with a possible dislocated kneecap. Actually, it turned out that although he needed an x-ray, his knee wasn't too bad, and so rather than him waiting in the majors area for those precious cubicles, we were actually able to fast track him through x-ray into the minors area, which was the best place for him to get his treatment. We've just worked through a staffing model for increasing the staffing across the emergency department. That's in process at the minute, but we've also are recruiting staff to different initiatives, including the RAP process. Each day, all of the ED team members come in, they work flat out, and it does take its toll, but fortunately we have a really strong team who support each other, and to be honest, my team should be admired for the hard work and effort they put in, and I'm very, very proud of them working in difficult circumstances. We've recruited a GP, which is really exciting. We are able to refer patients to GP out of hours when that's open. However, we don't have that same facility in hours for patients who present with a problem that could potentially be managed in primary care. Now, It's actually quite a difficult and complex process in triage to refer patients back to the GP, because obviously there's quite often issues or perceived issues with appointments. So we're now going to have a GP working alongside our nurse practitioners and our own ED doctors within the minors area to provide care for patients who could normally be provided with care in GP but have presented to the emergency department.